Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome. You are listening to Resonating Reflections with me, Fatima Jabbie, on Ramadan Radio 87.9 FM, online at ramadanradio.org and streaming on live Facebook with our guest today, Dr. Mohammad Abu-Asi. Thank you for joining us, Dr. Mohammad. Please call, text, WhatsApp with your feedback, questions and comments on 077 614 60614. That's 077 614 60614. Thank you. So, Dr. Mohammad, how are you today?
Alhamdulillah, assalamu alaikum, Fatima, and assalamu alaikum to all the listeners and viewers, and Ramadan Mubarak, Ramadan Kareem. Alhamdulillah, thank you very much for inviting me today to speak.
No, pleasure. You are an old guest, actually, so thank you for coming back and joining us this year again for Ramadan Radio. I'm going to really just have an introduction to yourself. You have a long list of accolades, mashallah.
Mm-hmm.
So I understand that in 2005 you qualified as a doctor. So you've been actually, 10 years on the NHS frontline staff, and then you went on to be a support to NHS practitioners. And you're currently, you have a master's in dermatology, and you're currently doing a master's in public health. You've also done pastoral care for 2 years as residents welfare lead. So really, I'd like you to add to that, because I know I haven't covered your list, but I know you also support students' welfare and doctors and dentists. And of course, in these times as we're in, we've just gradually, slowly coming out of a pandemic. You've been really been a backbone of support for the well-being of staff members, and really just being a pillar in helping people deal with their mental health in this crisis, and I guess their day-to-day lives. So please do go on and tell us more about yourself.
Thank you very much, Fatima, and thank you for the kind introduction. And yes, I mean, by background, I did study medicine. I came to the UK in 2000 to study medicine, and then I qualified in 2005, worked, as you said, in the NHS for 10 years in frontline, and then pursued more of an academic interest and did a master's. And then, yes, the last couple of years I have been working at King's College London in the student residences, supporting the welfare and well-being of students, as well as another role that I do is with NHS Practitioner Health, which is a service supporting doctors and dentists with mental health and addiction problems. And as you mentioned, with the pandemic, mental health and well-being has been affected by all, and they've been very testing circumstances and conditions for everyone. I think supporting one another and being kind to one another and looking out for another are sort of key messages that we try to get out there. And the openness and breaking down maybe stigma of mental health and the taboo. So those are all really important, and it is an ongoing sort of struggle, if I can use that word. But yeah, it's both very challenging but also very rewarding. And I think sort of looking back at my own experiences and my own personal journeys, I think when we talk of health, often we focus on the physical, but I think the mental and the mental and spiritual are just as important. And for me, health encompasses mind, body, and soul. And hopefully we can go into that in more detail.
Yes, we will. Yeah. We will. Thank you for giving this. So, of course, you've come from the frontline staff, and you're now dealing with a lot of students. So what I'd like to ask is, what triggered you to make the change from frontline to academia?
I've always been interested in academia, and I think, you know, in medicine, part of, you know, it's one of those jobs which is like an apprenticeship. You're constantly learning and working, and I think I've always been interested by the college environment, and recall sort of my experiences as a medical student, and even going back to school, and the importance of the role of a teacher and the facilitator. And I think for me, part of the drive to go into academia and also you know, well-being and mental health was reflecting on my own experiences, and also trying to support others, and thinking back to when I was in a situation, or when I was going through university. At the time, maybe the services for mental health and support and weren't as established as they are now. So I think part of me wanted to sort of go into that and explore that journey. And also, I think the working hours are a bit more friendlier.
Yes.
And I think the importance of work-life balance. I think for me, it got to a point where, you know, I was sort of thinking of my own well-being and my own work-life balance. And I think that was a very important deciding factor.
Okay. Amazing stuff. I mean, not that either is easier. They're both just as demanding, I'm sure. What I'd like to ask is, what challenges did you face in your journey, and how did you overcome those?
Yeah, I mean, I think when embarking on any sort of journey or changing career, there's always kind of obstacles or barriers, or the unknown. And
Certainly.
I think certainly it's knowing who to ask for help or support or advice, and navigating through all of that, you know, can be quite challenging at first. But I think keeping an open mind, and not being afraid of asking questions, and also, you know, doing your research and looking into what career options are out there. But I think ultimately you need to think about yourself. What drives you? What gets you up in the morning? What ambitions or goals that you've set yourself, and how you want to achieve those. But yeah, I think it was a sort of a journey, and still is. And you kind of discovering and rediscovering your interests, and your likes and dislikes, and I think that was part of the process, is the ups and downs, and then you kind of look back and think, okay, you know, what went well and what you could do better next time. So yeah, it was challenging, but I think each challenge brings with it also rewards.
Absolutely. And did you find that you needed to do extra qualifications, or is it a matter of having to do, I guess in the teaching sector you do PGCE,
Yeah, that's
correct?
right. Yeah, so I did a couple of sort of postgraduate certificates in terms of education kind of related, and also at the same time asking family and friends who from a teaching background, and also finding out what their recommendations as well. But yeah, I think nowadays with any career you choose, it often, you know, it's qualifications are very few, and
Yes.
I think it's sort of knowing which qualifications are relevant, and also at the same time how they can apply to what you want to achieve in the long term, and their relevance. Yeah.
True, exactly. And of course, you're currently doing a master's in public health.
Yes.
So,
Yeah.
which is so fitting because of the times we're in, and the challenges we're facing day in, day out. So,
Yeah.
you know, what advice would you be taking into consideration? Should we be taking into consideration as a general population to take control of our own well-being?
I mean, again, it goes back to, I think, what I was saying earlier about health, the definition of health. What does health mean to you as an individual? But then also, what does it mean to your family, your friends, the community, and the sort of population as a whole? And I think health means different things to different people. And I think that's part of the challenge, sort of how you define it. But then at the same time, you know, as you mentioned earlier, we're all going through a pandemic at the moment, you know, 1 year on. And, you know, I think how challenging it has been for all of us, but then also how you can get your messages across to the community and to the population and the public at large is very challenging. And but at the same time, it's also got very rewarding because it makes you also reassess what your definition of health and you know, so yeah, it is you know, quite challenging but rewarding at the same time.
At the same time, exactly. And we're in, Alhamdulillah, the blessed month of Ramadan. So even the fact that we as Muslims, fasting is part of our lifespan. But I know that there has been research which has actually proven to show that fasting does benefit, you know, our bodies. So as a doctor, how can we incorporate this in our life, whether you be a Muslim or not non-Muslim?
I mean, I think in terms of you know, in terms of fasting and the importance of it, as you mentioned, you know, there's the kind of the spiritual benefits of it, and then also the physical. And if you see nowadays a lot of, I mean, I'm not an expert in sort of nutrition and diet, so I have to kind of obviously make sure that's clear. But at the same time, you know, a lot of diets that have come out in recent years, sort of in terms of intermittent fasting, where, you know, you're abstaining from food and water, you know, for upwards of 15, 16 hours. That resembles what we are going through at the moment in Ramadan here, especially in the UK and in countries where the fast is longer. And so even within that, I think, you know, subhanAllah, like the benefits of fasting in terms of, it's sort of like, I see it as a detox of the body. You reassess your diet more carefully in terms of, you know, what foods will keep you going during the long fast, and also what how you break your fast. And then also with the praying as well, the benefits both spiritually but physically as well. The act of praying is also physically very rewarding. So I think there's more and more research into the benefits of fasting, and you know, I think that's a topic in itself. But
exactly. So in terms of Ramadan preparation, I mean, how do you feel like people should be preparing? I mean, we're in the midst of Ramadan now, so halfway point. In terms of people who are struggling with, like, example, caffeine, changing or switching diets, what advice would you give these people who are struggling?
I guess, I mean, I sort of reflect on my own sort of experiences, but I think, I mean, you know, I think I found sort of the month prior to Ramadan starting, I started reducing my the hours in which I'm eating or drinking. So and then also trying to cut down on caffeine gradually rather than abruptly, because that often can cause a sort of a rebound effect in terms of anxiety and stress. So I think you know, I think planning ahead is always important with anything you do, and I guess sort of gradually cutting down, like especially things rich in caffeine, because that often is the thing that people can struggle with, knowing.
Yes. And it's actually a drug that's legal. I mean, because it's addictive, and people can have, you know, headaches. Even it can lead to sometimes insomnia if you really have it, you know, in your system to the point that you're having palpitations throughout the day. So I've been told that it's best to cut out caffeine completely from your diet if you can. But as you said, gradually is.
Yeah, I mean, I think, you know, everything is in moderation is my sort of general kind of mantra. Like with you know, like you say, caffeine, it can, you know, can be addictive. Too much of it, as you mentioned, can result in palpitations and sweating and also anxiety as well. And if you then, are cutting it completely out, you're bound to get some sort of rebound effect. But a lot of people need that cup of coffee in the morning or that cup of tea. It's also the social aspect of meeting friends and family, and often over a cup of coffee or a cup of tea. So I wouldn't advocate getting rid of coffee and tea completely.
Is that being a coffee drinker yourself?
I mean, to be honest, I think before coming to the UK, I never used to drink coffee and tea, but it did become part of part of the culture. And part of work in terms of. But I find like with Ramadan, because when we're breaking our fast in the evening, you don't normally have a cup of coffee in the evening or tea. So I think I find that I can do without it. But then as soon as Ramadan is over, I gradually get back into the sort of old habits and getting.
Agree. And also, since we're talking about health and preventative measures, I know you've been involved in the COVID vaccinations. So how's that been?
Yeah, I mean, it's been a challenge. I think I've been volunteered and in terms of doing the actual vaccinations, and it's been. I think I did some work in January and most recently March, but it's great to see that a lot of people are taking up the vaccination, which is really important. And at the same time, we're still there's still more to be vaccinated. I think this week the 42-year-olds are beginning to get vaccinated as well. But also I've had the vaccine myself. I've had both my doses, and I think trying to understand also why some people are reluctant to take a vaccination. And this goes back to earlier about understanding what health means and people's understandings, people's apprehensions about health and vaccinations. It's fascinating, but it's really important to be able to have those conversations and understand people's apprehensions sometimes when taking vaccines.
And fears, I guess, because we don't know the long term. But how have you found any side effects, or how did you feel in your body or your system when you took it?
I think when I had it, I remember my shoulder felt very sore for a day or so. I remember feeling a bit hot and cold at night when I was asleep. But within a day or so, I was back to normal. And second time when I had the second dose, it wasn't as painful, the shoulder pain. And and I've had vaccinations in the past in terms of when I was working in hospital. We have to have regular vaccinations for various conditions. So, I was never in doubt of wanting to take the vaccination, but at the same time, I understand that not everyone feels comfortable having vaccines, and it's understanding why that is, and trying to unpick certain apprehensions and misinformation.
Yes, how do we tackle misinformation? Because a lot of it is coming from, I guess, social media and fake news, or sort of just is it based on facts? I mean, how do we make sure that people are getting the right information about the vaccinations?
I mean, I think again, I'm not I don't work within the vaccination program per se in terms of what information goes out there, but I think with anything, it's being open and having conversations and understanding, and I think with any health related issues, you always have to understand what your ideas about something are, what your concerns are, and your expectations about the consultation. Those are all kind of key things that we used to get taught when we were at medical school and at work. But I think it's really important, for people to have conversations with their GP, their healthcare providers, but also within the family and within the community. And yeah, you're right, you touched on it. Social media is both a good and bad thing. And sometimes, well, a lot of the times, wrong facts are sort of put out within the social media, but also within even broad, within other formats of media. And I think, trying to unpick that can be challenging, and sometimes too much information can be quite overwhelming.
Yes.
But I mean, my advice would be to speak to the experts, speak to your GP, speak to the healthcare providers, and also, within the community, speak to, like, for example, the community leaders, and have those conversations, and be open and honest about why you're pro or anti vaccination or any other health related matters, or anything for that matter.
Yeah, exactly.
Yeah.
Thank you. And I think as well, we're not maybe used to using our mosques as a community to talk about these things, for example. But I think that it would be a great idea to have like workshops where people could go and get, information if they have fears and worries.
Definitely. And I think actually I was at the mosque in Regent's Park quite recently, and I think I remember the Imam announcing that even at the mosques they're using it as a potential place for vaccinations to happen. So and I know other facilities, churches and temples have been used as a place to vaccinate. So I think you're absolutely right. It's important that those community leaders and religious leaders as well are sort of open about it. And I remember the Imam at one of the Friday ceremonies talking about the importance of the vaccinations and getting that message across. So I think those conversations are happening, and it's great to kind of hear it and see it at the same time.
Yeah. I mean, it's steps forward. So inshallah, it gets easier, and maybe because I know, for example, when people start wanting to travel, the requirement of negative testing is still going to be necessary. So it's important that people start planning ahead and thinking about these things. So I'm glad you touched on that.
Yeah, I mean, absolutely. I think we were just talking earlier about how to book a holiday to go see family, and each country has its own rules and regulations. And I think the UK also has its rules about who can travel and where. And I think it's just being aware of what the government and Department of Health advise, and at the same time also where you're traveling to, and understanding what the requirements are over there. So there's various logistical things that need to be thought of and dealt with, and it's a challenge, but hopefully we can all be able to travel safely, and I think that's the key word, safely.
Absolutely. And right now, I mean, the vaccinations are free, from my understanding. But I know that for people who have been traveling, I've got some family relatives that travel, but the COVID test is about ranging from £150 to 200. So it's actually quite expensive at the moment to travel with all the tests and that need to be taken. But yeah, so it's something to consider as a population, and it is about safety at the end of the day. So I guess we'll see. But yeah, it's a choice ultimately.
Mm-hmm. Yeah, absolutely.
So I'm going to look at your role now as a mental health supporter, and I know you support dentists and doctors who are struggling, because sometimes we think that the people who normally take care of us, the general public and the patients, are okay all the time, but of course they're human and they're not okay all the time. So how do you support those people?
Yeah, I mean, I think it's a challenge. I think it's sort of being breaking down barriers and stigma of mental health, and that's just across the population. I think doctors and dentists and healthcare workers in particular go through a lot of stress and anxiety and other mental health problems, and they work in a very challenging environment, and also long hours, and can find it difficult to ask for help. And I think that's the key thing, to know how to ask for help, who you can ask help from, and also increasing awareness and breaking down the barriers and the stigma. And I think it's better now in terms of people are more aware or speak out more publicly about mental health. But yeah, there's still that message still needs to go across, and it's really important that we support one another and look after one another and be kind to one another.
Absolutely. Yeah. And it's fantastic work you're doing. I'm wondering, what kind of addiction cases do you normally have to deal with, and how overwhelming that must be for you? How do you take care also of your mental health?
Yeah, I think addiction problems range from drugs, alcohol, and gambling, for example, and that is the same as the general population. I mean, my kind of role has been in terms of supporting doctors and giving advice in terms of doctors and dentists who may be having problems in terms of investigations or complaints, and how to deal with that, and how, at the same time, how to look after your mental health and well-being. And at the same time, I think trying to think about your health, as I said earlier, from a physical perspective, from a mental health perspective, from a spiritual perspective, and getting that work-life balance right, which is an ongoing thing, and setting yourself maybe smart targets, so specific, measurable, achievable, realistic, and timely. So each day, maybe, for example, you want to do some exercise, and setting yourself, okay, today I'm going to do 20 minutes of a walk, or a brisk walk, or a jog. And then also, for example, hopefully now with the easing of lockdown and restrictions, we'll be able to meet with friends and family. And with the weather getting better, that always seems to lift up the mood as well. So in making the most of the sunshine as well. And at the same time, looking after the community as a whole, and the family, and doing group exercise activities. Those are all really important, but every person's perspective on their health is important to address, and at the same time trying different things, different activities, and just keeping your mind engaged and busy as well.
Absolutely. I know you are an avid bike rider, so you're quite great with taking.
I don't know about the bike riding. I'm an avid jogger, but I don't know if avid is the right word.
Bike riding, okay.
No, I haven't done bike.
A lot of people have taken up cycling.
Yes, I mean that's on my to-do list. So I did put that down last June as one of my. I still haven't actually gotten onto those Santander, or what they used to call Boris bikes. That was one of my on my birthday sort of to-do list. I still haven't done it yet, but yeah, no, definitely biking, cycling. And I think, I remember last year with the beginning of the lockdown, because the traffic was much reduced, especially in central London, more people took up cycling, which was fantastic. And I think, over the last 20 years living in London, you could see there's more cycling lanes. It's become safer to cycle, but it's always important to wear a helmet. I always advocate wearing helmets as well. But I think, cycling in parks, or cycling, along the river, but any exercise, and it doesn't have to be, very strenuous. It could be going out for a walk with a friend. It could be going to the gym now. We can go back to the gym. It could be doing a group sport, basketball, football, whatever. I think that's really important. I think a lot of people enjoy group, sports because it builds team spirit, and you're engaging with others.
Yes, and it just makes you feel good. And that's what you said. It links back to maintaining our mental health in the positive rather than consumed with negative.
Yeah.
And we can. I learned recently that for every one positive thought, there are two negative thoughts.
Mm.
So, or two or three.
Yeah.
But see how much you have to combat or to
Yeah.
replace that. It's a constant effort.
Mm.
And I know, for example, you were volunteering with MEND, and you created wellness boxes
Yes, so
for
this last
hospitals.
year, yeah, so last year, a colleague of mine who we went to medical school together posted on her social media about the NHS Wellness Box, and a friend, a doctor at King's College Hospital, and his wife, Vishal and Sina, they both set up NHS Wellness Box. So in essence, it was a way to thank frontline NHS staff for their hard work and their efforts, especially during the height of the COVID pandemic last year, and still. And it was a very simple idea, in terms of creating these boxes with all sorts of um, goodies, if you like. Like a bottle of water, some nutritious healthy bars, some crisps, and then also hand creams and moisturizing cream, because a lot of the NHS staff were having to wear PPE and face masks, which was irritating their skin, and as well as providing information leaflets about mental health support and well-being advice. And I think for me, the sort of the most rewarding item on that was these thank you cards, which were designed by children,
Children.
and personal messages which people had written, like thanking the staff. So that was a fantastic project to get involved with. And like you said, yourself and various volunteers from MEND last year, and also at King's College, the residences, we used Stamford Street, which is one of the residences in Waterloo, as a assembly base, and from there we were able to get volunteers to come along. And this was also during Ramadan last year that we
Yes. Oh my God. I can't believe a
yeah.
year has gone by.
And we were able to make over, within our kind of group, over 800 boxes, and there were various projects going on at various other hospitals. So I think in total, I think it must have been upwards of 6,000 boxes which were created for NHS Wellness Box, and the feedback was remarkable and amazing from the staff. And I just recently gave a talk about that project and how we did it, and hopefully we're planning to do something similar to thank the frontline staff here at King's College London, who for their hard work, housekeeping and security, and the reception staff who had to come to work during pandemics and keep the campus running. So it was very rewarding, and I want to take this opportunity to thank you and all the other volunteers for your hard work. And I think
it was amazing, fantastic work that you
that also doing volunteer work and charity work is really important to connect with others and network. And during the month of Ramadan, there's always sort of possibilities to organize iftar or deliveries for people fasting. And I know normally you can invite people around to break your fast with, but obviously because of COVID at the moment. But I think it's charity work and volunteer work is one of the most rewarding, if not the most rewarding things you can get involved in. So I highly recommend it.
Agree, and thank you for bringing us on board with that initiative as well. It's just, I mean, it's even more beneficial in Ramadan, because as Muslims, we know that deeds are multiplied, the rewards are even more in Ramadan.
Yes, yeah.
So it's a great opportunity to use Ramadan time to do charity work.
Definitely, yeah, absolutely. I think it's sort of like it's multiplied the reward. So and I think hopefully, I mean, with Ramadan, it's kind of, for me personally, it's like a time to reflect on who I am, where I want to go, but also kind of setting yourself also for the rest of the year and continuing to, be humble, inshallah, and modest for the rest of the year as well. But I think you're right, hopefully it's a springboard to continue to do that during the rest of the year.
Yeah, and you said it's about coming together as well, because of course COVID showed us that, well, COVID didn't discriminate.
No.
So it's all about humanity really pulling together to overcome these challenges.
Yes, absolutely. And yeah, I think, like you said, COVID doesn't discriminate. It affects everyone, all races, all ages, rich and poor. And I think hopefully my hope would be, if anything good that could come out of this pandemic, is that as a people, as a humanity, we all come together and we treat each other with respect and kindness. And I think that would be hopefully a great thing. But yeah, it's important to continue to be good and kind to one another.
Thank you. Now, what advice would you give to people, young people, who are thinking of, switching from medicine to going to teaching?
I think with any career, I think for young people, it's very difficult to decide, at a young age, 16 or 18, what you want to do for the rest of your life. And I think it's, having a conversation, if you have a careers advisor at school, but also with your friends and family, and focus on what you like, what you dislike, and what your strengths and weaknesses are, and what you enjoy doing. And sometimes it's trial and error. I think you start working in a particular career or in a particular field, and circumstances, personal or professional circumstances, may change. But it's trying things and keeping an open mind is very important.
And don't feel like you're tied to this, one path.
No, I think nowadays, also with what's happened with COVID, a lot of people are having to work from home. So that's also brought, challenges, both good and bad, in terms of, some people are able to spend more time with their family, their children. But also it's important to physically get out of the house, and like we said earlier, the exercise and interacting with people face to face is really important. So I think, thinking back to when I was deciding on a career, growing up as a child, I wanted to be a fireman, I wanted to be a detective, I wanted to be, I think doctor was the last thing that I sort of settled on. And I think, I was very fortunate in that my father was a doctor, and I was able to take his example as very, as an inspirational, kind, thoughtful person. And interestingly, he never sort of said you have to be a doctor. He just said do what you want and what you enjoy. So I think that's what my advice would be to young people, and even adult, older people as well. Do what you enjoy, do what makes you happy, but also do something where you can get a good work-life balance. That's really important.
Yes, I mean, as you said, it's shown that, but also it requires, I guess, commitment as well, and it's hard work. I guess you have to be willing to put that work in. And I remember you told me something about realizing our limitations as well.
Yeah, definitely. I mean, I think with anything, like you have to work hard for it, and there's no two ways about it. I think also opportunities that present itself, you have to make those opportunities happen. And I think, like earlier when we talked about volunteering, it's an opportunity to meet people from different backgrounds, to network and to find out what they do. But you're absolutely right. With anything, you have to put in the time, the effort. So, study hard, get the grades, but also, think outside the box. And, I think for me also, discovering other areas that you're interested in, like arts or subjects which you may not have necessarily thought you would be interested in. Reading is very important. Reading about various topics and various subjects. So yeah, it's a challenge, but it's a journey. That's how I see it.
And worth it. So
Yeah.
hey, so what has your experience been like as a Muslim in the field you're in?
Oh, that's a very interesting question. I mean, I think being able to work, and for example, a lot of workplaces nowadays have prayer rooms or places where you can go do your prayer. So that's really important. And then I remember quite a few of the hospitals, even within the college, that they'd have like Friday prayer, which is really important, because that's an opportunity to, reconnect with your religion, with your community. So, but also, I guess, like now during the month of Ramadan, working when the hours are long and you're fasting, and that can be very challenging. I think it's certainly people are more aware as well in terms of work. And for example, I remember reading an email that the college had sent out. They do like weekly emails, updates about events that are going on, and they would often say, for example, the holy month of Ramadan is going to be starting on this day. And just a kind of description of what Ramadan is, and some of your colleagues might be fasting, so they won't be eating and drinking.
Fantastic.
So that increases the awareness, and it's interesting because then your colleagues and friends will come up to you and ask you, so why are you fasting, and why do you not, and does that also mean you can't drink water? And yes, it means also no drinking water, but explaining sort of. And for me, I find it as an opportunity to kind of remind myself and also educate myself, like, why do we fast, and where did it all come from? And again, that sense of community, of coming together, but also supporting those who are less fortunate than us. Mm-hmm. And the importance of, being pious and modest and humble, and again, using that as a springboard to how you should be the rest of the year as well. So I think it is a challenge, but I think it's great to see that non-Muslim people are also aware of Ramadan, and want to ask you and engage with you in conversations.
And amazing, because you also have solace in faith.
Yes.
Especially in the hospital environment.
Mm. Yeah, I mean, I think absolutely. I think for a lot of people, I remember when I was in hospital, like they would want to see a priest or an imam or a rabbi, or a person, religious person, because being in hospital, it's a very can be quite a very difficult time, and being able to connect with your religion and speak freely, very important to people. And it's the same, I think a lot of people get solace from their religion and from their belief and from spirituality. So it's really important to be able to do that.
Okay, so now I'm going to touch on, what do you see yourself doing in, I don't know, in the next 5-10 years? You're from a Palestinian background as well. How do you want to fit that in, your identity as a Muslim, as a Palestinian, definitely, in the future?
Yeah, I think so. Now I'm doing my master's in public health, and hopefully I'm kind of long term. I'd like to work with refugees and sort of asylum seekers, and sort of how you improve health for marginalized groups, and also continue with the kind of supporting doctors and dentists with mental health and addiction problems. So hopefully that's how I see myself, or that's the kind of direction that I see myself going towards. But I think at the same time, maybe once COVID is over and we're able to travel, maybe working abroad, or being able to travel and work overseas would as an opportunity would be amazing.
the experience of traveling. I mean, it just the exposure, in fact. And so would you recommend people to do that as well if they're thinking of, getting as much experience as possible in terms of the field that they decide to work in?
Yeah, I mean, I think I remember also before some students after they'd finished their A levels would do a gap year, for example, and go overseas and work and teach language or do an internship or do traveling. I think that's really important to see other cultures and other countries and mix with other people and that kind of knowledge and experience that you gain is amazing and very fulfilling, I think, in terms of as it shows growth and maturity as well. And we're very lucky here in London, where we live in a very multicultural and diverse city, and we mix with people from all backgrounds and faith and religions. And I think it's great that we're able to ask people from different countries and backgrounds about where they've been, where they've traveled. And I think certainly I would recommend that.
Thank you. So, Dr. Mohammad, any concluding remarks before we wrap up?
No, I mean, thank you very much for inviting me back, and it's an absolute pleasure, and I really enjoyed speaking with yourself, and I would probably say, yeah, just echo what we've talked about before.
For our listeners, yes.
Yeah, definitely.
So, in your words, don't be afraid to ask for help.
Absolutely. Be kind and be kind to one another, and be kind to yourself. I think that's really important.
Yeah, why do we forget to be kind to ourselves?
Yeah, I think that's often one of the biggest sort of obstacles is so obviously we're kind to one another, hopefully, inshallah, but at the same time sometimes we are our harshest critics, and it's really important to first of all look after yourself, your own well-being and physical and mental health, but then you're able to help others. So yeah, be kind to yourself. I think that would be my finishing remark.
Number one, yes. And it just reminds me of what happens, when you board a flight and they're talking through the safety protocols.
Procedures, yeah.
They always say put the mask on first on yourself.
That's correct, yeah. And the life jacket on yourself before helping others. Yeah, that's true.
Because if you're not strong, if you're not feeling secure, then you will not be in a position to help your fellow being, ultimately. So I'd like to thank you for coming on and joining us today on Resonating Reflections and sharing your invaluable experience. I hope you have, you continue to do the amazing work that you're doing.
Thank you.
And it gets easier, inshallah. But yeah, I hope the rest of your Ramadan is fruitful. And if people do want to reach out to you and get involved in wellness boxes, how can they reach you?
Yeah, I mean, I think I can certainly leave in terms of contact details, like my sort of social media handle. I think, hopefully we'll be doing these wellness boxes again soon, maybe June or July. But also, it'd be great to hear from people their experiences and their suggestions in terms of who they would like to thank. If it could be your teacher, it could be public workers, it could be someone from the community. It'd be great to kind of hear people's experiences.
Amazing. Thank you. So I'd like to say Jazakallah khair, and thank you to our guest, Dr. Mohammad Abu-Asi, and to you all. You've been listening to Resonating Reflections with myself, Fatima Jabbie, on Ramadan Radio 87.9 FM. Up next is Islamic Heritage, So do stay tuned. Till next time, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Mohammed.
Assalamu alaikum.
Alaikum salam.